Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. How long does it take Tepezza to work? In studies with Tepezza, teprotumumabtrbw, some, but not all patients began to see less eye bulging and double vision by 6 weeks, after the first 2 treatments. At 24 weeks, 80 out of 100, 80% of patients, saw less eye bulging compared to 10 out of 100, 10% of patients, taking a placebo, an inactive treatment. Improvements in eye bulging continued over the course of treatment and results lasted over 51 weeks. Double vision was also improved with the use of Tepezza, with 7 out of 10 patients, 70%, having improvements. 5 of 10 patients, 50%, saw their double vision go away completely. For certain patients, pain, redness and swelling also subsided by 6 weeks. Tepezza is used to treat thyroid eye disease. It is given as an intravenous, infusion, injected, into your vein. Tepezza is administered to patients once every 3 weeks for a total of 8 infusions. The full Tepezza treatment regimen lasts about 5 months. You may start to see some results with Tepezza before all 8 infusions are finished, but continue treatment as prescribed by your doctor to get the full benefits of treatment. How long will my results last with Tepezza? In one study conducted by the manufacturer, over half of patients, 16 of 30 patients, who had less eye bulging, proptosis, at 24 weeks were able to maintain this response for 51 weeks after their last infusion. About 2/3, 12 of 18 patients, who had less double vision at 24 weeks were able to maintain this effect for 51 weeks after their last infusion. In Tepezza studies, no patients were given corticosteroid treatment. Eye bulging was reduced by an average of 2.3 millimeters. Is thyroid eye disease common? No, thyroid eye disease, TED, is considered a rare and serious autoimmune disease that can cause proptosis, eye bulging, diplopia, double vision, blurred vision, pain, inflammation and facial disfigurement. In an autoimmune disorder, the immune system is overactive and starts to attack healthy cells and tissues instead of fighting off infection or other foreign intruders. TED occurs in about 16 of every 100,000 females and 2.9 per 100,000 males. But severe symptoms of TED are more commonly found in men. TED often occurs in people living with hyperthyroidism or Graves' disease. It can eventually lead to blindness. Because the swelling behind the eye causes bulging, your eyelids may not completely close. You may develop symptoms such as dry or gritty eyes, tearing, blurred vision, and light sensitivity. TED is caused by autoantibodies activating an IGF-1R-mediated signaling complex on cells within the retroorbital space, behind the orbit of the eye. Bottom line. In studies with Tepezza, teprotumumabtrbw, some, but not all patients began to see less eye bulging and double vision 6 weeks after they started treatment. At 24 weeks, 8 out of 10, 80%, of patients saw less eye bulging compared to 10 of 100, 10%, of patients taking a placebo, an inactive treatment. Improvements in eye bulging continued over the course of treatment, 8 infusions given over about 5 months. This is not all the information you need to know about Tepezza, teprotumumabtrbw, for safe and effective use. Review the full Tepezza information here, and discuss this information and any questions you have with your doctor or other healthcare provider, RxCardClub.com. Get a free prescription drug card and save up to 80% on prescription drugs.